Welcome again, learners. Welcome to this class. We are on our 7th topic in our health and wellness unit. And today we are going to learn about cancer. Cancer is one of the leading health problems in our communities, in our country, and even worldwide. And some have labeled cancer as a menace because it's causing a lot of physical and emotional suffering to the individual who has cancer, and also to the family and to the community in terms of resources required for the management, and also the time that is utilized by the person who has cancer. So we're actually going to look at what is cancer. What is this we are calling a menace? What is cancer? How can cancer be diagnosed? What are the different stages of cancer? What strategies are used to diagnose and manage cancer? And what are the various technologies available for the management of cancer? We'll also look at what triggers cancer. But most important, we should look at and we should know is how we can prevent cancer. So when we are looking at the definition of cancer, we can say cancer refers to any one of the large number of diseases characterized by development of abnormal cells that divide uncontrollably and have the ability to infiltrate and destroy the human body tissue. So cancer often has the ability to spread throughout the body. Once it starts from one organ or a few cells, it continues spreading, multiplying very fast, and then spreads to to many parts of the body. And we find that cancer is the second leading cause of death in the world. So it is a disease of concern. So cancer is a generic term for a large group of diseases that can affect any part of the body. Any part of the body can get cancer. So other terms that you'll find being used for cancer is like malignant tumors, neoplasms, and other words that are used, but the general word that is used is cancer. And one defining feature of cancer is the rapid creation of abnormal cells that grow beyond their usual boundaries, and which can then invade adjoining parts of the body and spread to other parts of the body. The latter process is referred to as metastasis, when the cancer cells spread to other parts far away or remote areas of the body, and they go and cause problems there. So widespread metastases are the primary causes of death from cancer. When it goes to those other organs, they are the ones that will lead to death. When we are looking at some of the key facts about cancer, it's the leading cause of death, accounting for more than 10 million deaths in the world. So the most common cancers that are there is like breast cancer. We've heard of breast cancer, lung cancer, colon cancer, rectum and prostate cancers. There are a number of these, quite a number of these. About a third of them are caused due to tobacco use. Others, it's because of high body mass index for people who are overweight. Others are due to alcohol consumption and lack of physical activity, and others is because of the wrong diet, like when we don't take fruits and vegetables in our food. We also have, in addition, air pollution is an important risk factor for lung cancer. We also have cancer-causing infections such as the human papillomavirus and the hepatitis viruses. They are responsible for approximately 30% of cancer cases in low and mid-low income countries. The good thing is that most of the cancers can be cured if they are detected early. When they are detected early, they can be cured and cured completely. So how do we diagnose cancer? Or how can cancer be diagnosed? Cancer is diagnosed using a combination of methods, starting with a physical examination. The client also gives a medical history, and then we move to the laboratory tests, which can be done, and then there are the imaging tests like the X-rays, CT scans, MRIs, and ultrasounds, and other specialized procedures that what we call the endoscopies. Those ones can be able to diagnose cancer. But the most definitive way to confirm a cancer diagnosis is through a biopsy. A biopsy is where a tissue sample is removed and examined by a pathologist to determine if the cancer cells are present, and then to understand the type of cancer and the aggressiveness of the particular cancer in case it is there. So what are the signs and symptoms of cancer? So the causes of cancer will vary depending on what part of the body is affected, so the signs will be different. But some of the general signs and symptoms associated with cancer, but not specific, will include fatigue. One feels fatigued. There could be a lump or a swelling in the area that you can even feel under the skin. On touch, you can feel the swelling. There could also be weight changes, including unintended weight loss or gain, and then skin changes such as yellowing. In case the liver is involved, one may see the yellowing in the eyes. Yeah, there could be darkening or redness of the skin. There could also be sores that won't heal, or changes existing moles. If it is involving maybe the intestines, there could be changes in bowel and bladder habits. There could be persistent cough or trouble when one is breathing, difficult swallowing, hoarseness of voice when one has a problem with the cancer is involving the throat. There could be hoarseness of the voice, persistent indigestion and discomfort after eating. And then there could be persistent unexplained muscle or joint pain, persistent unexplained fevers or night sweats, or unexplained bleeding or bruising. Yeah? So when, for cancer to be properly diagnosed, we have to do what we call staging. After a biopsy is taken, there should be staging. So cancer staging describes the tumor size, the location, and the spread, while grading described how abnormal the cancer cells look under a microscope, and also how aggressive they are, meaning how fast they can spread. So staging helps determine the extent of the disease and guide treatment decision using systems like the TNM system, that is the tumor, nodes, and metastasis. All others, the doctors can use others like simpler ones like the numerical stagings, stage 1, stage 2, stage 3, or stage 4. So grading often a scale of 1 to 4 helps predict the cancer likelihood of growing and spreading, with the higher grades indicating more aggressive cells. So that means if it is at stage 3, stage 4, it has really progressed. So when should we see a doctor? So make an appointment with your doctor if you have any persistent signs or symptoms that concern you. If you don't have any signs and symptoms but are worried about your risk of cancer, discuss your concerns with your doctor as well. Then you can have the screening test done. Then ask about cancer screening tests and procedures, because these are going to help detect if there are risks of cancer or you have it early enough. The causes of cancer, we can say cancer arises from transformation of normal cells into tumor cells in a multi-stage process that generally progresses from a precancerous lesion to a malignant tumor. So these changes are the results of the interaction between a person's genetic factors and 3 categories of external agents, including physical carcinogens such as ultraviolet and ionizing radiation. We can also have chemical carcinogens such as asbestos, components of tobacco smoke, alcohol, aflatoxin, that is if you're eating food that is contaminated with aflatoxin, yeah, or drinking water that is contaminated. Then we have the biological carcinogens, such as infections from certain viruses, bacteria, and also some parasites. Yeah. So we have said again, risk factors here, they look at tobacco use, alcohol consumption, unhealthy diet, physical inactivity, and air pollution are risk factors for cancer, among and also other non-communicable diseases. So some chronic infections and risk factors for cancer. This particular issue is low in low and middle income countries. Hepatitis B and also hepatitis C viruses are some types of human papillomavirus, increase the risk of liver and cervical cancer, respectively. So infections with HIV increase the risk of developing cervical cancer 6 times more than people who don't have the human papillomavirus. So they have a risk of developing cancer, and they also risk developing some of the cancers like Kaposi's sarcoma. So how can we reduce the burden of cancer? So between 30 to 50% of cancers can currently be prevented by avoiding risk factors and implementing existing evidence-based prevention strategies. The cancer burden can also be reduced through early detection of cancer and appropriate treatment and care of patients who develop cancer. And many cancers have a high chance of cure if diagnosed early and also treated appropriately. So for the prevention, we said in our expectations for today, before we finish, we look at how we can prevent cancer. So we find that cancer risk can be reduced by not using tobacco, maintaining a healthy body weight, eating a healthy diet, including fruits and vegetables, doing physical activity, avoiding or reducing consumption of alcohol, getting vaccinated against human papillomavirus, hepatitis B, and also avoid ultraviolet radiation exposure. Yeah, these are ways to reduce. Yeah. We can also reduce outdoor polluted air, where we have a lot of polluted air. So we also need to access to clinical evaluation and diagnostic services, and also timely referral if one is found to have a problem. Because we have said when there is early diagnosis of symptomatic cancer, this one can be managed early enough. Screening also aims to identify individuals with findings suggestive of a specific cancer or precancer before they have developed symptoms. So when abnormalities are identified during screening, further tests are normally done to establish the diagnosis and then the next line of actions. So a correct cancer diagnosis is essential for appropriate and effective treatment, because every cancer type requires specific treatment. So the treatment of cancer usually includes surgery. There could be, that is removing the area that has the cancer or the cells that are affected by cancer or the organ. It could be radiotherapy, it could be chemotherapy, and also hormonal treatments and targeted biological therapy. So thank you so much for listening. So ensure you do your part, respond to the queries in this topic, and also do the quiz that is there. Interact with the journal and do the discussions. And remember to watch the video that is there. Otherwise, I wish you to enjoy the learning and all the activities so that we are enlightened on these conditions that are of great public concern. Thank you so much for listening.